Dr Vamsidhar Kedar. I am a consultant pediatrician, pediatric intensivist, and allergy and asthma specialist with Lotus Hospitals for Women and Children in Kukatpalli. So today we have a discussion about the monsoon problems along with developmental milestones. I do hope that everyone gets a good idea about it on India on TV. I would like to thank the India on TV to give me this opportunity to discuss about these burning issues as of today.
Now we will discuss about the common problems that the children face during these monsoon seasons. Monsoon seasons are considered to be the most important seasons every child passes between 2 to 5 years. In between the 2nd to 5th year, this is the time where every parent should be very careful about. Lot of diseases are usually seen in this particular time of the year. I am going to discuss about certain core issues which usually pop up during these periods. The most important thing here is the diarrhea and dysentery. Diarrhea and dysentery by and large mean the same. Any loose motions without blood is the diarrhea. Any motions with blood and mucus could be dysentery, and dysentery is usually associated with high-grade fevers. The diarrheal diseases and the dysentery usually comprise of a spectrum of disorders which is called as gastroenteritis and dysentery, and this is broadly, when in discussion, we term it as gastroenteritis. Gastroenteritis is usually seen because of hand-mouth contamination, or it is basically a waterborne disease. In this climate, in the pre-monsoon season and the monsoon seasons, the water becomes usually contaminated due to waterlogging, and lot of bacteria usually grow in the drains, and due to the overspilling of the drainage system also, certain bacteria might overflow into the freshwater supplies, and the water contamination is considered to be the most important reason for the transmission of the diarrheal and dysentery diseases. Now here, the most important treatment that is usually taken as a part of home remedy is to prevent the child from eating outside, going out, and a strict hand washing technique should be emphasized and taught to every child so that the infection transmission is controlled to the bare minimum. And the most important treatment that is usually given for diarrheal diseases is plenty of liquid intake. In a viral diarrhea, antibiotics play a very minimal role, and in dysentery, antibiotics do have a role. If the child comes with loose motions, with dehydration and no fever, usually the primary focus of treatment is to control the dehydration and allow excess fluid intake in the form of ORS, the oral rehydration solution, which is recommended by the WHO. Now, if the child comes with a high-grade fever and blood and mucus in the stools, an antibiotic can be considered at this juncture, and also a stool analysis should be performed to know the exact cause of the infection, the extent of infection, and the amount of treatment that the pediatrician should take. Another important aspect of the monsoon problems is the acute exacerbation of asthmatic illness. A child who is a known asthmatic can have a little problem with acute exacerbation of an asthma attack because of the change in the climate, because of the change in the wind, change of drop in temperature and the rains. Children who are known asthmatics can get an acute attack of asthma. So to prevent this acute attack of asthma, child should be kept in warm clothes and prevent exposure to the cold waves, cold weather and cold air as much as possible. If the child is a school-going child, and adequate precautions have to be taken by consulting their respective allergist, an asthma specialist or a pediatrician, so to take care adequate steps in the asthma control and asthma prevention. A strong asthma management plan is recommended for the children of those who have a positive for asthma tendency. All asthmatics should carry their medication at all times, because an asthma attack, no one can predict when an asthma attack would start. Another most important aspect of a monsoon illnesses is the dengue. As the rainy season sets in, because of waterlogging, the mosquitoes grow, and the mosquitoes have a tendency to transmit two types of infections, the malarial disease and the dengue disease. Basically, the malaria is caused by the nighttime mosquitoes and the dengue is caused by the daytime mosquitoes. Dengue virus is, there are certain issues with the dengue infections. As we all know that dengue is a very difficult to treat infection, or rather no medication exists to kill that virus. Basically the treatment whatever is given is supportive care. In the dengue illness, there is a selective destruction of the platelets, and when the platelets are destroyed by the dengue virus, there is a tendency for the child to develop fluids in the lungs and abdomen. Also, there is a tendency to develop bleeding all over the body. Also, the bleeding can occur in the brain, lungs, liver, kidneys and pancreas. This is the most important side effect when the platelet count really drops. In dengue, basically the treatment that is given is plenty of fluids and supportive measures like giving paracetamol for control of fever. In the hospital setting, once the diagnosis is made, a careful check on the platelets is done serially once in every 24 hours, and if the platelet counts really drops, or if there is a bleeding tendency, if the platelet count is really low, helping the bleeding to occur more profusely, then platelet transfusion is usually given. Another important aspect of the monsoon illnesses is typhoid. Typhoid is usually caused by a bacteria which is called as Salmonella typhi. The Salmonella typhi is the causative for typhoid, and there are certain class of infections similar to typhoid which is called as a paratyphoid fevers. The typhoid fevers and paratyphoid fevers are commonly seen during this particular time, where water contamination with that particular bacteria occurs, and once there is a hand-mouth contact with the contaminant water or substances, this typhoid can occur. Typhoid is usually seen as a fever for more than 5 days duration, and the investigations of typhoid usually come positive only after the 5th day. I mean, even in typhoid, in the first 5 days, typhoid test is usually negative, except if it's an immunological test. The regular test, which is Vidal, which is done, is usually positive after the 5th day of typhoid. Then the child has to be kept under close watch, hydrated properly with IV fluids, and then appropriate antibiotic cover should be given to control the typhoid infection. Another most important thing that we usually see starting from the monsoon months till winter months is the emergence of pneumonias. Because of a lot of changes in the atmosphere happening, a lot of viral pneumonias and bacterial pneumonias also can happen. A pneumonia is defined as a lung infection where the infected material is present in the chest, and bacteria or virus helps in the growth of the infective material. This causes disturbance in the air exchange in the lung and thereby causes deterioration in the lung function. For these sort of children, if the pneumonia is severe, it mandates hospital admission, and then this hospital admission, after which we give certain class of medications either by aerosolized or nebulized solutions and by giving IV antibiotics. If it's a viral pneumonia, supportive management with paracetamol, IV fluids and nebulization should be given. I want to make a point here by the use of nebulizations. The nebulizations are indicated as a case-wise basis. It is not a cure for asthma, neither it is a recommended treatment for asthma. Nebulizers should be used under the strict purview of the pediatricians and the doctors only, not always at home. Nowadays, according to the standard recommendations internationally, which is the GINA guidelines, in asthmatics, nebulizer is no longer recommended. Rather than an inhaler is recommended.